Have you ever wondered if you qualify to be a co-author on a project you worked on, or if you're a primary author and wondering who to give authorship and there's a confusion around it? Hi, my name is Dr. Rahul Kashyap. I'm a physician scientist. Let's talk about this issue of who to give authorship and who may be qualified to become a co-author. And this question is going on for a while, so I thought we should just record this and then go over with in next few steps as we go through. So first and foremost, this is a criteria from ICMJ, International Committee of Medical Journal Editors. They give these four criteria that anybody who meets these four criteria would meet authorship. Number one is anybody who has done a substantial contribution either in the concept or design of the work, or the acquisition of data, collecting the data, analyzing the data, or interpretation of the data or the work piece of it. That's criteria number one. Number two is anybody who has drafted the work or reviewed it critically for important intellectual content. That means somebody who's wrote it or somebody has edited it or provide the critical revisions. Third, that they have to be approving the final content to be published. And four, they are accountable for all aspects of the work as well. So three and four criteria is something I think we'll go into a little bit more detail with criteria number one and two. If you meet one and two, it's just a matter of time that you'll meet three and four. So let's take it further and see how to decode this, that who are these when they say that who has done substantial contribution and so on and so forth. So if I take these criteria and then put them into these four areas as the criteria one and two talks about it. Number one is conception or design. Most likely, this is somebody you as a first author, as a mentee, maybe a medical student, maybe a pre-medical student, maybe a resident, a fellow, or a junior faculty member, or a mentor. You and your mentor most likely are the people who are coming up with this concept or design of the study. So usually one or two people, they meet the criteria from get-go. Now, second one, acquisition or data collection. That means anybody in your team who has helped you collect the data, either for survey, for patient data collection from electronic medical records as well, or reviewing editing data automatically from data mart or bigger databases for that matter, they meet the criteria to have collected data for your project for criteria number one. Third one, analysis. Most likely this spot is reserved for somebody who's a data analyst, either a PhD, master's, or a mentor or co-mentor or one of your colleague from a residency or medical school or anybody who has actually analyzed the data for you. They meet the criteria to be a co-author for that matter. And maybe somebody else, there's more than one person who might have done that for you as well. Now, the most confusion comes in between the interpretation. The interpreter could be your colleagues, your co-authors, or your co-team members. It could most likely is going to be your mentor for sure. Maybe a co-faculty member who is co-mentoring you, or colleagues who have such subject matter expertise, and they are telling you what this result means for that matter. Anybody who has helped interpret the data, and basically they are the one who helping you write that particular section, either methodological analysis piece of it or the result section where the data get interpreted, they meet the criteria to be a co-author for the first criteria. Now, the second criteria is drafting or providing critical intellectual components. Drafting means usually you or your mentor or you or one or the two co-authors, probably junior authors, maybe a medical student or maybe a resident with you who are doing the first draft of the manuscript after data has been analyzed. Critical reviewing piece comes back where most likely your mentor is helping you edit it after the first draft you have made it. It could be a data analyst who are talking about the method sections when they've written it, they're reviewing it as well. It could be a resident or a co-author or a co-faculty member who is helping you edit the manuscript for that matter. Basically, anybody who meet the criteria one, and you give them a chance to either write part of the manuscript or edit or review the part of the manuscript they can contribute, they will also meet the criteria number two for that matter. Just very important to know, if anybody meets a criteria from number one out of these four, and then you give them a chance to write or edit it, they will meet the criteria number two as well. So importance of the criteria one is very, very high. And once you understand that how criteria one and two will meet, that makes your life really easy. Now let's turn into criteria number three and four. Criteria 3 and 4 are a little bit easier. It tells that any author who gives a final approval to be on a paper meets the criteria number 3. It could be yourself as a mentee or your mentee, a medical student, a resident fellow who help collect the data collection, data analysis, your mentor and whatnot. So anybody you give a chance to provide as a final approval from who meet the criteria number 1 also will meet the criteria number 3 because they have to finally approve it. They have to just say yes, I approve the study, and so on and so forth. And then criteria number 4 is accountability agreement. They should be accountable of any and all aspects of the work as well. Again, same, any mentees, mentors, anybody you're working with, anybody who met the criteria 1 and you give them a chance that they provide the agreement, they will meet the criteria number 4 as well. So basically, if we go back and then look at criteria 1, that is one of the most important criteria that anybody who has helped you in conception, data collection, data analysis, or data interpretation. And after that, if you give them a chance to write or edit it, and then they should approve and be accountable of the work, they will meet the criteria for being a co-author. Or if you have done any of these, you meet the criteria for being a co-author on this manuscript or any manuscript you work on. Just to keep in mind, it creates a clear guidelines to make sure that anybody who's done work, they're not deprived of this work as well. And somebody who doesn't meet those criteria should not be a co-author. So I'll stop right here. This is a short video, but as a teaser, next video we'll talk about what does honorary authorship means, or what's the ghost authorship mean for that matter as well. Just to give you a hint, you should never give an honorary authorship to anybody or have ghost authors on your paper. Till then, please like and subscribe our channel so then you get to know about the next video we'll record it. Thank you so much, and we'll see you soon.